COVID-19 prevention for Bend Lapine staff. What can I do as a staff member to slow the spread of COVID-19 in our community? Know the symptoms, do a daily self-screen before coming to work, monitor your students' health in school and in school-sponsored activities, follow protocol for reporting, and stay home when sick, and encourage students to do the same. What are the high and low risk symptoms of COVID-19? You can find these symptoms on page 3 of the BLS Ready, Set, Learn Communications Guidance for COVID-19 document. High risk symptoms: cough, difficulty breathing, loss of taste or smell, fever of 100.4 or greater, and chills. Low risk symptoms: congestion, runny nose, nausea, vomiting, diarrhea, sore throat, headache, body aches, and fatigue. It's important to remember that even mild illness should be taken seriously. How can I detect these symptoms in my students and athletes? Visually assess students for changes to skin color and behavior. Listen for cough. Look for obvious runny nose and report these symptoms to your front office staff or nurse. Also listen closely to what students are saying. For example, self-reported symptoms, COVID-19 exposure, or family members being tested. So let's say I have symptoms, or I learn that one of my students or athletes has symptoms. What do I do next? For staff, tell your administrator if you are not feeling well, or if you've been exposed to COVID-19, and the expectation is that you will go home immediately. A nurse will follow up to discuss your situation further. If a child is sick at school, contact the nurse or front office staff so they can check the student into the isolation room. If a parent tells you their child is staying home sick from lippy or athletics, report this to your attendance secretary and nurse immediately. How long will I, or my student or athlete, need to stay home for? If the person has one low-risk symptom and no COVID exposure, they can return to school and athletics 24 hours after symptom resolution. For vomiting or diarrhea, they can return 48 hours after resolution. If the person has one high-risk symptom and/or 2 low-risk symptoms and no COVID exposure, they have 2 options for returning to school or athletics. Option 1. The expectation is that they will stay home for 10 days from symptom onset. Option 2. The person may return to school or athletics earlier if they see a healthcare provider and present the BLS Return to School or Work form and present a negative COVID-19 test result. In order to return safely for both options, symptoms must be improving, must be fever-free for 24 hours without medication, and must be in adherence with the Schutz County Communicable Disease Exclusion Guidelines. If you are exposed to COVID-19 or learn a student has been exposed, report this to your building administrator immediately. A nurse will reach out and ask that person to quarantine for 14 days. Front office staff, please don't forget to send sick students home with a COVID-19 packet containing info on symptoms, testing, and the important return to school or work form. Staff, you can find this form in the BLS Ready, Set, Learn Communications Guidance document. We need your help to keep our schools healthy and open. Please keep in mind that if you travel outside of Oregon, the expectation is to quarantine for 14 days, beginning when you return home before returning to work. We know that no single preventative measure is perfect on its own, but combined, they are powerful. Please ask students to wear a mask, physically distance, hand wash, and stay home when they are sick, and do the same yourself. Thank you so much for your hard work and dedication during this trying time.